welcome back. Several doctors are seeing an increase in strep throat among children right now, and the rise in cases is made worse by a shortage of the drug used to treat the illness. So this afternoon, our pediatrician Dr. Theresa Horton is back with us to discuss some of the symptoms that parents need to watch out for and then what we can do to help treat it. So, of course, first off, thank you for coming in today.
Thank you,
and being with us. Let's get started kind of diving in about what parents should be looking for with the increase in strep throat cases.
So yes, we had a nice break from strep with the social distancing, and it's definitely come back with a vengeance. It started a little earlier and is a higher rate. So parents, what they would look for, of course, everybody knows sore throat, fever, headache, you may get vomiting or some body aches. If there's cough, congestion, runny nose, or eye discharge, then you're probably working with a virus and not strep.
And then, you know, is this a typical time of year for strep?
It is a typical time of year because December to April is when we usually will see strep. So hopefully we're going to see a downward slide on it, but it actually started early, and a lot of the usual time periods for illnesses have not been what we've expected lately, so it could go longer.
Oh boy. And then, you know, kids are in school still, so how contagious is strep throat?
So strep throat is pretty contagious. It's not as bad as, say, flu or chickenpox, but because kids touch everything and they touch their mouth a lot, that's where it's spread. It's spread from droplets that come out of mouth and nose. So parents can help their children stay well by teaching them hand washing and trying not to touch the mouth and nose, not sharing food or drinks.
Okay. Now let's say a child has it, or my child is complaining of a sore throat. When do those symptoms become bad enough that they need to be seen?
So, you know, it is sometimes hard to tell in the beginning. If they're just saying a sore throat, but they don't have fever and they're acting fine, you could give it a little time to watch. But if the sore throat is increasing, especially if it looks extremely red, you may or may not see the white pus pockets with strep. That can also go with viruses. But if it's really red, or if there's fever, or if you know that they've been exposed to a case, then it would be a good time to come in and have them seen.
Okay. When we get them seen, we've heard there's a shortage in amoxicillin.
There has been a bad problem with shortage of amoxicillin, which is the best treatment for strep because it works well and it tastes better than any of the others.
Oh yeah, trying to get a kid to take horrible tasting medicine is not easy.
It is not easy. So luckily the shortage isn't as bad as what it was, but we are still seeing some problem. It is possible to teach young children to swallow pills. There are also other medications that can work for strep as well. What I really try to encourage parents to do is, if they have trouble finding the medicine, to notify their doctor right away, because you don't want to put off treatment. The longer you wait, the longer it takes to feel better, and then of course it puts them at a little bit higher risk of having a more severe case.
Yes, yeah, you want to take care of it right away. Well, thank you so much, Dr. Horton, for coming in today with great tips on how to keep our children healthy. We appreciate it.
Thank you.